His most recent book, he wrote for families that can't get to him or to one of us that are trained in his method. And it's called Disconnected Kids. I think this is the third edition, and it's a go-to manual. It is the go-to manual to deal with, for example, ADHD is a great term to describe, to get a general picture of the way I think and the way I approach my brain care, even with brain trauma, my stroke patients, my motorcycle accident patients, car accidents, athletes. The idea is that if we go back to the term or the letters ADHD, we've got attention deficit and hyperactive. As we talked about a couple weeks ago, when I talk about attention, when we talk about attention deficit, we're referencing more, say, a right hemisphere in terms of its ability to inhibit distraction. Okay? It inhibits, if I can speak in very general terms, we're going to say the right side is going to inhibit looking around in class for the child. The right side is going to inhibit the outbursts. I've got a question right now. The right side is going to inhibit those distractions. So if the right side isn't as strong as the left, then the initiation side, the left side, the initiation, it may become overwhelming for the child and they want to initiate everything. They may not be able to control their outbursts, to keep to themselves, to wait till the teacher's done talking. They may burst out with an answer right away rather than waiting for the teacher to end the question. They anticipate, they initiate. So there's ADHD. With that in mind, what we want to do is not look at it so much as a genetic disorder or a disability. I know the label disability gets a lot of funding, and I understand that. But the idea is, think about what's taking place here. If I'm over-initiating, I'm actually demonstrating a strength on that side. So what I want to do is, when I'm dealing with something, a very basic ADHD, and we went through the types, type 1, 2, 3, in a very general application, pretend it is just a lack of being able to inhibit outbursts. Keep it simple. All I want to do then is strengthen the right side. I don't want to dampen the strength, if that makes sense. What I want to do is ramp up the right side and get, if I can imagine, a lot of times the left side, they have outbursts. They're verbal. They're very focused attention, like right here, right now. When it gets real extreme, you try to take something from an autistic child, they're going to be upset because they're not done with it yet. Very, 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 very focused, immediate short-term goal. Achieve this, achieve this, achieve this. Play this game to the end, play this game, watch this video to the end, watch it. They've got the short-term focus, but they don't have the long-term goal, like I may be able to focus on my teacher. They don't have the why, if that makes sense, or their why is very, very restricted. So they don't inhibit the initiation of everything. So what we want to do, imagine if they've got these gigantic verbal skills and say they're super verbal, they're reading it at the age of 1 and they're blah, 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 and like this kind of behavior. Imagine if I could get, maybe they test out at 130, 140 on the left, their verbal skills. They actually test out at almost genius level. Imagine if I can ramp up a 70 to 100, 110, 120. Imagine if we can ramp up their right brain skills, and there's a lot of overlap. Okay, so it's not like this only does verbal, because remember, this does verbal word find, this does definitions. This side does comprehension. What did the whole book mean? What did the whole story mean? What was the writer's goal? Why did they introduce this character? This is the big comprehension. This is the big picture. This is the details. So imagine if I can get the big picture as strong as the details. Imagine if I can ramp up a genius level verbal left and I can ramp up the right side to literally work with that. Now I've got a super genius who really is very good at expressing themselves and understands everything, can get the big picture, can put things together. I mentioned it before, I think. Einstein, they consider him a right brain genius. He was considered, if we use the terms today, he was considered a special ed student growing up, but he turned out to be considered one of the smartest people we've ever known, right? So that's the hemisphericity stuff. Then we talked. Oh, okay. And so then we talked. Last week we focused on ADHD and dyslexia. A lot of that was based on the questions were asked from the week before. Hugely important concept because, again, imagine now dyslexia. Would that be a strong right or a strong left? And again, if we're having trouble reading words, and there's a couple different reasons, but pretend it's just word definition, word finding, then we've got usually a weak left hemisphere, okay? And at that point, they're going to have a stronger right side. So they're going to be more, they listen, they want to comprehend. There may be some hard, if they lack reading skills, they may lack hearing skills, and that could influence dyslexia also, because then even though they see the letter, if they've got hearing disruptions, like I said, there's a variety of causes for dyslexia. It's not just letter inversion and stuff. But imagine if they're having a weak left hemisphere, they're not good at word finding, they're not good at defining the word, they're not good at really getting the word part of it, okay, and the structure of it. But they're real strong on the right. So they enjoy listening to the teacher. They enjoy having things explained to them, and then they've got the big picture. So now what would I do? We'd want to train the left hemisphere and ramp that up. And there's a variety of ways to do that. We talked a little bit about, we use cold lasers. We use class 3 cold lasers. That way nothing gets warm. We're trying to provide, there are cells in our bodies that are chromophores and chromatophores, whatever research you're looking at. They're light sensitive. And they help the cells, they help create more ATP through light energy. And that light energy turned into ATP allows the cells to do more of what that cell is trying to do. You see it with exercise all the time. They've got the Amazon is going crazy with different red lights. Remember, those are LEDs. They're a little different. Some of them are good. They just don't have the level of intensity, so you're going to have to sit under them for longer than what the therapy we use in the office. But they work, some of them. The idea is we use light therapy, we use sound. Today, we're going to talk about the 12 cranial nerves. Just to be clear, though, the first 2 aren't truly cranial nerves, but they're labeled cranial nerves, and we'll talk about that. Different ways like taste, sensation. If we can get more light into, like I said with athletes, if we can get more light into that, imagine along with stimulating taste, stimulating sound, and we're trying to light something up with a cold laser. All these stimulations force those cells to do more, and then the therapies, the cold laser we use, then provides more energy for that. So that the cells can heal, they can grow, they can make their connections. I mean, every time, a clean example in our office, I use it all the time with my patients. Oh, how can I get my brain better? Will it really work? Oh my God, they've got all these depressing, they've had all this depressing news, and they're worried about, I'm old, I can't grow any new cells, I can't do this, I can't do that. Remember, when I talk to a patient, I'll remind them, before you started coming to this office, you didn't even know how to get here. So your brain, as simple as that explanation is, picture it. You didn't even know how to get to the office. Now you're negotiating the traffic. It's wintertime down here, so we've got even more traffic. And the patients have learned 40, 30, 20, 70 years, 80 years old. They've learned something new. The brain made new connections. And like I said, with all the other stimulations we provide in the office, your brain is always learning new stuff. So don't take it for granted. Just because we age, we can't learn. We can learn. And all we have to do, like I said, I say it all the time. You train it in, you train it out. We train a lot of stuff in. When we're working with patients, whether they're young kids or adults older than me, we're training in new things all the time. It really is. We're training in new patterns. We've got it, even just like I said with the exercise. You light up the body while you're doing stuff. It makes the muscles, they can create more ATP. The muscles can do more, light up the whole room. That way the patient has all of this coming in. Like I said, with red light, the contraindications we do keep, though, or we're very aware of, is pregnancy, because you don't want to disrupt any growth rates, and cancer, because we don't want to give a cancer cell any energy, any extra energy. But that was a couple weeks ago. My basis is hemisphericity with Dr. Robert Melillo. We talked about ADHD because that's a great example of all it is a functional disconnect syndrome. The brains are supposed to be connected, they're disconnected, and the function is off. FDS, functional disconnect syndrome. I know it's simple the way I'm saying it, but most of this stuff can be trained out. I've seen it, I've done it, and I know other people that have also. Now, the reason we're talking about cranial nerves is we talked about brainstem last week. One of the brothers mentioned that a family member, I believe, had a brainstem injury and things are off. Now, I'm not going to address any individual injuries, but what I'd like to do is talk about different things you can consider when dealing with a brainstem and rehabilitation and everything. Remember, like I said, with functional disconnect syndrome, what can I do? What is also in that area, right? And with the brainstem, you've got 12 different cranial nerves. You've got 3 different areas on the brainstem. You've got the midbrain, you've got the pons, and you've got the medulla. So imagine if we have a brainstem injury, generally speaking, very generally speaking, imagine you have an injury up here at the top of in the midbrain. Number one, you've got a top half and a bottom half. A lot of textbooks will say rostral, meaning towards the face or the upper side, and they'll say caudal, the bottom half, towards the bottom, right? So in the midbrain, I have a rostral and a caudal. In the pons, I have a rostral and a caudal. And in the medulla, in the medulla, I also have a rostral and a caudal. So if I've got a midbrain injury, let me go to the pons. If I've got a midbrain injury, I've got cranial nerves 5, 6, 7, and 8. Okay, so I've got 4 cranial nerves. Imagine if I have an injury on the top half of that, right up in here, if I can simplify it like that. Well, what's on the bottom half? Or maybe it's a right side or a left side, or maybe it's only affecting one cranial nerve in that area. Well, I still have 3 others, don't I? And if I have an injury in the midbrain part of it, why not use cranial nerves in the pons and the medulla to run through the midbrain portion? And like I said, the first 2 cranial nerves, olfactory and optic, are not truly cranial nerves. Olfactory or smell, olfaction, smell actually, if I can say it this way, rhine meaning nose, or rhinoceros, for example, right nose. The rhinencephalon, the nose brain is back behind here. It's in the mid-temporal areas. That smell center grows brain tissue right to the front, if I can simplify it that way. So now it's not a cranial nerve, it's actually brain tissue. And that's why it's so important with COVID. When you lose your sense of smell, you got to realize that's, depending on whose research you're looking at, that can be a 10-year window to let you know there's something's going on in there. And then what we do is we ramp up the training, we work on your memory centers, we work on everything, strengthen the brain, what we call get more cortical. I just used the word a little while ago. Reserve, cortical reserve. So we build up more brain reserve, all this stuff. So imagine you got 10 years to strengthen it before you get a diagnosis of dementia. And some people talk about even 20, depending on other indicators. So think about where that rhinencephalon is, and that first cranial nerve is not truly a cranial nerve, but as I've mentioned before, the smell is just unbelievable as a tool. So powerful. It stimulates memories. You smell for holidays or whatever we're talking, like here in America, we've got as non-Muslims, the Christmas holidays, the cookies the pies being baked, and you may smell something, or any of our immigrant brothers and sisters, you got these smells from back home, and you think about, literally, it stimulates a memory from another continent from decades ago in your grandmother's kitchen, or your mother or your father, or whatever took place. I'm all about smells and memories because I don't cook. I'm horrible at it. My kids, when we moved over here, the kids told my mother, don't ever buy dad another crock pot. So they don't have any wonderful memories of me cooking, but I have wonderful memories of my kids, my mother, that kind of thing, them cooking. But the idea is, think about what we can do with brain stuff. And the second cranial nerve is the optic nerve. And that, again, isn't truly a cranial nerve, and the way it comes in and does things and goes all over the place. And as we talked about before, remember, even though your temples and your parietal lobes are considered other stuff like sound and spatial relationship and muscular control and all that stuff, really important to vision, aren't they? So again, if we have any visual issues, stimulate and strengthen these. Now let's get into the cranial nerves, and we'll talk about different testing. I actually brought my testing sheets with me so that I could go over them really precisely. The third cranial nerve is oculomotor. That's actually eyeball movement using the muscles of the eyes. Cranial nerve 3 handles everything except trochlear nerve. That does angular movement up and in. Down and in. Anyway, that does angular eye movement. And then abducens, cranial nerve number 6. That does abduction or lateral eye movement. But 3 does the other ones, okay? So imagine what I'm going to do is to test that and to train it. Remember, most of these tests we have, if it shows a weakness or something else is weak, but that is strong, we can still use the test as training. With oculomotor, cranial nerve 3, in the midbrain, the top of the brainstem. Then remember, you've got the pons in the middle and then the medulla. So here we are in the midbrain at the very top of the brainstem. And I'm going to start with cranial nerve 3, oculomotor. What I do is I'm going to hold something, even your finger. You can do it yourselves. We talked about eye movements that I mentioned before that are really, really beneficial. In this case, I'm going to ask the patient to look at my finger, and I'm literally going to do just a figure H, because remember I mentioned superior oblique. This also tests abduction and cranial nerve 6. But I'm going to do horizontal movement, and then I'm going to do up and down. And this ties all of those muscles in except trochlea. All right. And that's cranial nerve 3. It also, believe it or not, it's really cool. Most people don't know this. Your eyes are opened and closed by 2 different muscles. Cranial nerve, 2 different cranial nerves. Cranial nerve 3 and cranial nerve 7. Facial. Yes. So literally, if in this case, I'll ask you, close your eyes, close them one at a time, because then it can also tell me a strength and a weakness. You should be able to blink one eye at a time. Some people can't. They cannot close. And then I say, like I said later on, another cranial nerve, open your eyes voluntarily and open one at a time, like I'm doing now. Some people can't do that. So then that's going to tell me, as part of my care plan, for example, if you can't open your left eye by itself, you have to use your right eyelid also, then I'm going to have you repeat that motion or that movement that you're lacking. And I'm going to stimulate, or one of the things we'll do is I'll laser that side of your brainstem, and you can either come in, well, the way we approach it, but I'd laser the left side through the mouth or right here behind the ear angled up towards the brainstem. So you can look at these different things. Like I said, what else is, as in my initial example with the midbrain, if I've got a problem up here and I can't get these two cranial nerves to work, then why don't I go after it with other cranial nerves from the pons and the midbrain? Does that make sense? And then you can come at it from the top down also with voluntary control, because that's up here. The next one is trochlear. Like I said, with that, it's going to be eye movement down and in. The way it attaches is really cool. You can look up the Greek word or Latin word, whatever it is. Latin, I believe. So trochlear helps down and in. So then literally it's take the finger and you can test, of course, one eye at a time is best, and then test them together. And then you're just going to watch the finger and you're going to go down and in. And then my left eye down and in, and then there. And then you can also bring it in and do the nose touch. They should be able to see. I wear glasses, so it's not as easy, but sometimes I'll do my homework and they should be able to see one finger. I want to use one finger, one thumb, all the way to within about 2 inches of their nose. And then when they start seeing two fingers, if it's farther away, if it's out here, then what you're going to do is train it. Does that make sense? A pencil, a pen, your thumb. And then you're going to try focus, get one finger, then bring it in a little closer. If it's two, you stay on it till it's one, stay on it till it's one, stay on it till it's one, and then you're normal. Does that make sense? So with that in mind, even in that area, now we're moving into cranial nerve 4, we're still working with the eyes, aren't we? So here we are doing eye movement. The other muscles are still slightly involved with this, even though I'm emphasizing the trochlear nerve. I'm still dealing with eye movement, initiation and inhibition. The medial rectus, as I do the trochlear, there's a muscle called the medial rectus that's going to help me move it in. Does that make sense? That's up above in cranial nerve 3. So when I'm dealing with a patient, what else is there? What feeds into it? What part of the brain is it, right or left? Do I want them not to do something? Do I want them to do something? So it's one of these things. What else might be in the area, or what else assists with that? For example, I'll jump ahead. Cranial nerves 7, 9, and 10. And in a lot of research, we'll say 5, 7, 9, 10, and some include 11. All of these cross-stimulate each other. And cranial nerve 5 is gigantic. It's called the trigeminal. It comes down out of the skull, down as far as your neck in terms of your second, maybe even as much as your third cervical vertebra, or the third bone in your neck. Imagine how big that cranial nerve is. So imagine if you can light up, and we'll talk about it next, cranial nerve 5, your trigeminal. This is really cool. General sensation to the face. Okay. And it breaks into what we call, meaning the Roman numeral 5. Okay. We're going to call it 5-1, 5-2, and 5-3. So imagine just that by itself. If I have a weakness in 5-3, I'm going to stimulate. Okay. It kind of like this. You got your ophthalmic branch, your maxillary branch, and your mandibular branch. So imagine if the mandibular you don't have any sensation here. Then I'm going to stimulate these other two up here, the upper ophthalmic and maxillary, stimulate those. There's going to be some feedback and some stimulation into the maxillary. Just that nerve by itself, we can cross-stimulate it. Now imagine it's huge. So now you've got cranial nerve 5, 7, facial, the motor. So now I've got 5 is facial sensation. 7 is facial motor control. Then I've got 9 and 10. 10, I'll jump right to that. 10 is the vagus nerve. Sympathetic, calm. You want a strong vagal nerve. It involves its swallowing, its digestion. Vagus, one of the main places right here, coming to the surface of the skin. That's why using a Q-tip just on the outer edge of the opening can ramp your system down. That's why we get all these, you see these things advertised all over the place for vagal nerve stimulation, and they clip them either here or deep here or here. This area is really good for stimulating the vagus nerve. But imagine now, like I said, 5, and think about, hopefully I'm not jumping around too much. Think about what I said. 1, 2, 3, and 4 are considered midbrain. 5, 6, 7, and 8 are pons. 9, 10, 11, and 12 are medulla. Imagine if I have a weak vagal nerve. I've got bad digestion. I'm very emotionally dominant. My emotions are all over the place. There's no calm. There's no vagus stimulation. And poor digestion can be reflective of that. One can cause the other, but they'll both make each other worse. Emotions can wreck your digestion. And of course, poor digestion is going to ramp you up too. And it probably is very emotionally related, believe it or not. Vagus nerve. So imagine I'm up here stimulating cranial nerve number 5. And like I said, it's gigantic. Facial sensations. There are times when I literally will ask a patient, listen, you've got to tolerate your husband or your wife stroking very gently, just light touch the face while you talk. Because 5 is so big, its influence on the nerves that it cross-stimulates, they cross-stimulate each other. Its stimulation at 5 cross-stimulates 10. And then imagine if you're doing something like that. I'm massaging and being a gentle talk and speak, and it's you got to tell them you got to tolerate it because it's good for you. And then imagine if you're just messing with the ears a little bit. Believe it or not, I have patients. If it's a child, we have to have the parent will try to train it in. It's stimulating vagus can be life-changing for some people, and it could be something. They can't handle the ear part, but they can handle stimulating 5. Then you want to stimulate 7, what we call muscles of mastication. Have the kids chew gum, believe it or not. Have the kids chew anything that's safe. Because 5, 7, 9, 10, and possibly 11 cross-stimulate each other. So think about what's taking place there. So now we want to ramp up vagus. So we stimulate 5, 7, and 10. 5, 7, and 9. And 9 is glossopharyngeal. Yes. Glossopharyngeal, swallowing, all that stuff. And vagus is important to that. So you want to stimulate vagus, rub your ears and swallow water. And talking, actually, deep breathing, stimulate diaphragm, massaging the organs. But that's cranial nerve 10, cross-stimulated by a gigantic cranial nerve 5. You can also do sharp and dull to the face on the V1, V2, and V3. I also check clenched jaws. We want, this is important. With 5, believe it or not, does the mouth open in a straight line? Or does it deviate? Some people, if it goes off, think about where 5 and 7 come out right behind the TMJ. Normal patient can stick 2 fingers in their mouth. Good 5, right? Pulse ox, again, cross-stimulating 5 and 10. 10 is very important to heart rate and respiration. I should be able to rub the eyes, facial sensation, and I should see a pulse drop between 6 and 10 points. Have the patient seated and make sure, but again, a contraindication, make sure they don't already have low blood pressure or they have any heart conditions that lowering their heart rate might be a problem. And I don't have to do all these tests. If something comes up like that, I just don't do that one. Blink reflex. They taught us in school, you can touch the eye with a piece of a cotton ball very gently. That reflex should be there. Then you can measure how quickly they both work to see if one side's weaker than the other. I use a little air poofer, the same thing, a little rubber ball that I got it to clear baby sinuses. I've never used it for that, if any patients are watching, but that's what I use. I poof air into the corner of the eye, and by the time I move to the other eye, they're already anticipating, so they've got a strong cranial nerve 5. And then the jaw tap if you want to. It's like the reflex when the doctor taps your knee or your forearm, your bicep or your tricep. You can tap the jaw and you should get a little quiver. You've also got a tap right here, and you can tap that, and the lips will pucker. And then cranial nerve 6, lateral rectus, or eyeball abduction, moving your eyes outside. So this one fires, and this is really cool because when I'm looking to the outside, this nerve fires, and there's a whole group of the way the fibers come together. And cranial nerve 6 also stimulates 3, as I mentioned earlier, to get the medial. This is lateral rectus or lateral eye movement. Then I need medial eye movement to go with it. So imagine if the left eye or the right eye, one eye can go all the way out, but the other eye only comes about halfway with the same movement. Now what am I going to do? I've got to find out whether it's cranial nerve 3 and the medial rectus showing weakness in movement, or is it 6, or is it 6 and that's not firing strong enough? And then you also want to, with eye movement, one of the great overrides is whether your cerebellum works or not, whether your cerebellum works smoothly. Very important to reading also, a smooth cerebellum, because if I can't get my eyes working in conjunction to each other, that's the cerebellum is hugely important for that. And again, now I want to improve eye movement, so I'm going to improve cerebellar movement, cerebellar function. And that could be balance training, smooth movement, coordinated movement. The cerebellum smooths out everything. I mentioned that before. It smooths out your thoughts. It smooths out your emotions. It smooths out your muscular function. It's balance. It's really training. Improving cerebellar work can actually improve eye movement and coordination work also. Now we're going to go to cranial nerve 7. And again, as I go through these, the overriding thought for all of us is, if 7 doesn't work, what's near it? 5, 6, and 8. If 7 doesn't work, for example, then how am I going to cross-stimulate that? I know 5, 7, 9, 10, and possibly 11 all help stimulate each other. So then maybe I'll work on 5, leave 7 alone, or I'll work on that with a couple of these tests. I'll stimulate 5, I'll stimulate 7, and then I'm going to stimulate 10. I'm going to really work on parasympathetic stimulation. You can massage the abdominal cavity because all of those organs are controlled for digestion by vagus. Hugely important. I massage I do it in the office with the patients, training their spouse or their parent, right? And it's just very gentle, but I do a lot of abdominal massage. Briefly, I demonstrate it a lot. That's how I should say it. I demonstrate it a lot or teach it, not as a massage therapist, but just as a stimulation to the abdomen. All I'm doing is rubbing a little bit over the entire abdominal cavity. I want the intestines involved. I want the stomach involved. You've got the pancreas a little bit. You've got a liver over here that's going to feel something. All those organs are influenced by the parasympathetic nerve vagus. So now imagine 7. I'm going to look at one of the things we do a lot in the office. I do a lot is I'm going to look at the lines in the face. Okay. I'm going to make sure all the wrinkles match. That way I know both sides of the cranial nerves that influence the face are strong and even. I'm going to look at the lines along the side of the face. They smile. Eventually, as we age, you create these creases, right? They should be pretty close. Some people, you'll see one side of the face is real smooth. The other side has lines in it. Well, that means, guess which one's the weak side, right? The one without the lines in it. That's not good tone. That means you didn't use it as much to create the wrinkles, if that makes sense. That's why these Botox smooth faces, you are anesthetizing these muscles, and they are numb and don't work anymore. So they can't move stuff. I'm not a big fan of that. So literally, I'll look at the face. I'll look at the lines right here next to the nose. I'll look at the smile lines. Everything else is hidden under the hair here. You'll look for wrinkles across the top, the wrinkles in the here, to see if one side shows more muscle activity than the other. Does that make sense? And then I'll ask them to make facial expressions. Smile. I want to see if they move equally. Frown. I want to see if they move equally. Raise up the eyebrows, see if they move equally. And then imagine if this works, then I'm also going to use 5, massaging it, 7, stimulating muscle action and chewing, very important. And then this is the one, remember I talked about the cranial nerve that opens eyes. Cranial nerve 7 closes eyes. And I mentioned that earlier. But imagine now, voluntarily blink. I'm stimulating 7, right? Well, I'm bobbing my head too. That's kind of silly. Okay, so you're blinking, close the right eye by itself, close the left eye by itself, train that stuff. Now you are literally strengthening, as simple as it may be, and it's probably not a lot, but you're working on where? You're working on the pons, because that's cranial nerve 7. Now that's going to influence the whole pons area. So now that's going to influence 5, 8, and 9, right? It has to. And then you've also got hearing. If you clench the jaw, cranial nerve 7 also influences the word. I can't pronounce it. I believe it's the one with the S. It's inside the ear. You clench your jaw, or should make you. You should influence that, and you can even hear better. Yes. So now you've got, and again, something as simple as gum chewing or chewing can influence cranial nerve 5, cranial nerve 7. It's also going to, because cranial nerve 6 is in there, right? 5, 6, 7, there's going to be some overlap. 5, 6, 7, and 8. I said 9. 5, 6, 7, and 8. All of those influence each other because they're in the same location. What's near it and what else does it do? And then we'll move on to number 8, hugely important nerve, vestibular cochlear. Not only is that the vestibular part is part of your balance, it's actually really important as your first real balance training. Vestibulo-ocular reflex. We talked about that, and we talked about the training for that to decrease dizziness. The vestibular-ocular reflex, being able to separate eye movement from head movement. Focus your eyes while your head's moving while you walk or you drive, right? Or move your eyes while your head stays still to train it in. But this is my VOR. This is something you can do. I'll bring the head from the outside. I'll bring it in, and I'll bring it from up, down, and from down, up. I don't like going away because as a chiropractor, a lot of my patients, they might come in with soreness and neck pain anyway. So I bring from outside in, but a lot of times just be tested inside out. Okay. They keep their eyes on me. Boop. And if their eyes follow their head with that movement and leave me, I know there's a problem and a weakness. And then we can talk about that another time. Then we also have friction rub. This is the hearing part. What we're going to do is this. And then you should hear it about out to 12 inches. There, I can still hear it. So I would consider that normal. Then I also want to did that go out the same? Did that go out the same? And I'm going to check both ears together and one ear at a time and measure those. And again, if one side's stronger, if one side's weaker, then we're going to work on that with sound training. And again, 5, 6, and 7, because that's cranial nerve 8. They're all in the pons. I'm going to work them all. Train it in. Let's see. Cranial nerve 9, glossopharyngeal. Glossopharyngeal. Really important for tasting. And glossopharyngeal, meaning the mouth, the tongue, the pharynx, all that stuff. Bitter back 9 is the easiest thing to remember. You have bitter taste buds all over, but it's sweet, salty, and sour tend to be up front and along the sides, and then bitter is in the back. Bitter is a really strong sensor because a lot of things that are toxic are bitter. So before you swallow it, it hits the back, and it's actually really cool. Research shows that the way we're designed, right? The way we're created. Imagine bitter is in the very back. Imagine some foods got past you They weren't good for you. This bitterness is so bad and this food is so toxic. The back of your tongue and your throat are more likely to stimulate a retching and a vomit response than the front of your tongue, right? You spit it out, but something got back there and you're poisoned. It hits the back of your throat, and when your brain recognizes it as toxic, boom, it should come back up. So it's really cool how we're created that way with bitter in the back. And then the other test I would use is the test. In that case, I'm not looking at your tonsils. I'm actually looking at the soft palate, right? You put your tongue up, it's hard, the roof of your mouth. And then at the back half of it, it's considered a soft palate. That's under muscular control too, cranial nerve 9. What you're going to do here is take a tongue depressor, a spoon of whatever, and you don't have to go very far, and just and you want to look to see if the soft palate rises together. If one hangs lower than the other, what you'll see is what's called the uvula, that the thing that hangs down way in the back. If it swings this way, for example, that means this side lifted up and pulled it, this side didn't move. So now I know this side is strong, this side is weak, and I've got to work on, in my case, it would be on the right-hand side, and I'd be trying to stimulate that area of the brainstem, and I'd be doing other stuff like tasting bitter, and I might put it on that side of my tongue more, because most cranial nerves, all the cranial nerves except trochlear are ipsilateral. Okay, trochlear was the down and in one. All the cranial nerves come out ipsilateral, so they're handling that side of the face, the head, the neck, everything. Okay, so if it falls and swings and the uvula goes this way, then this side is weak, and I'm going to train that side. I'm going to laser that side. I'm going to bitter back 9 that side. I'm going to do other things for my left side of the brainstem. Cranial nerve 10, we already talked a lot about that because it's hugely important to darn near every aspect of our lives. Literally, that vagus nerve is everything they say about it, it's true. Every good thing. And then if it's weak, every bad thing, a lot of bad things can be attributed to the vagus nerve. The first thing we do is we do a lot of pulse ox. I want to see what the heart rate is, and we know the norms. Mine stays in the mid to high 60s. We want them to stay. They shouldn't be this 80, 90 and all this stuff. That's way too, what we'd say, sympathetic or way too elevated. You want to be down here. So I'll take a pulse ox and I'll do that. And then with a vagus nerve, I just want to know how high or how low it was. And I want to see how close to normal or lower it is. And that's what we're measuring at the same time. When we did cranial nerve 5 and the eye rub, I've got a pulse ox on them because I'm cross-stimulating 10. And by the time I get to the heart rate part, I already know what's going on. I have a good idea of what's going on because when I rub their eyes, I should see that fall. And I will rub for as long as a minute. If it doesn't fall within a minute, we've got a gigantic issue. And I know I'm going to be working with cranial nerve 10 down the road. All right. Let's see. The vagus nerve is also influential on the uvula. And then, so I'm going to stimulate 9 and 10. And again, like I said, 5 and 7 to cross stimulate all of it. Remember I mentioned earlier, massaging the gut. I'm actually listening to gut sounds now. I just break it up into 4 quadrants. I don't do the 6. And I'll listen with a stethoscope, and I'll listen for as long as 60 seconds. Whether you've eaten or not, I should hear gut sounds with a normal functioning vagus nerve. If I don't hear gut sounds within those 60 seconds in each area, then we've got an issue, and I know I'm going to have to work on the vagus nerve. And I can do that with the training the sound. Let's see, what else do you do for vagus nerve is involved with the throat along with the glossopharyngeal. So you can gargle, you can hum and sing out loud. I recommend do that in the car by yourself because you might annoy your spouse or your loved ones. But all of these stimulate vagus. And then, like I said, right there next to the ear canal, some research shows all the soft tissue in the area in the tragus or or the little ear triangle thing here. Now let's jump on to cranial nerve 11, spinal accessory. That's going to be your sternocleidomastoid and your upper trapezius muscles in particular, right? And you can stimulate those by using them. Head rotation against resistance, right? You can stimulate them with touch. Be very careful because that's all. Don't let my mother hear that. Your carotid sinuses are here, and you don't want to apply too much pressure. You can test for that. Apply pressure to the carotid sinus. The exact location leaves me right now, but you can put pressure on that and decrease the heart rate. You don't want to do that. Okay, so I don't do that test in my office, but certainly you're going to look at the level of the traps and the shoulders and see if they're level or not. If I've got an issue, then I've got to decide upper and lower motor neuron issues, or is it just the cranial nerve, right? And then finally, the hypoglossal, the easiest test out there, and the kids love doing this one, right and left. Hypoglossal, meaning under the tongue, hypoglossal. There's your test. If it deviates to one side or the other, which one's stronger? This one's stronger because it pushed it, right? And this one didn't push back. If this one's stronger, okay? So hypoglossal. There's all 12 cranial nerves. Then we get into, in the office, I do a lot of, remember we mentioned with ADHD and all that stuff, I mentioned I do 10 primitive reflex tests. There's a lot. I have a poster on two posters. One of them has probably 20 to 30 primitive reflexes. I test 10 of those. And we've got exercises Dr. Malillo put together that I use my patients, the parents. I teach them these exercises and they'll do those to get rid of the primitive reflexes, because after about the age of 1 and a little bit later for some of them, all of them should be gone. So if you're still demonstrating, even as an adult, I mentioned the story. I had a car accident, head trauma, and I checked his primitive reflexes, his rooting reflex. That's where you rub along the chin to the lip and from the cheek to the lip, and you want to hit both areas. And on the one side, he actually pooched like he was going to breastfeed, right? And that rooting reflex shouldn't be on an adult. So we had to do some brainstem work. And I gave him the exercise for that, and that's real simple. But we do check those because they are housed in the brainstem. So if those are baby reflexes and they are still there in an adult, imagine how big a problem that is going to be, because that interferes with what we call top-down control. That's bottom-up control. As our brains develop, and I mentioned it before, you've got the neural tube with the nervous tissue on the inside, brain pooches out everything, and your eyes tear away and pull muscles with them. That's why your eyes and your neck like to move together. As you get this bottom-up development, right, of the brain, you want then, as we age, you want top-down control. And if you've still got control now, down here in the brainstem, those primitive reflexes are still active. They interfere with cranial nerve function. They interfere with brain function. You are not running at 100%. So that's why we check cranial nerves. We also check primitive reflexes, and that it's just hugely important. The brainstem, and as the brother mentioned before, brainstem injuries are hugely important to brain function. And think about, even if there were no cranial nerves, even if there's nothing else in there, it is the connection between your brain and your whole spinal cord. And then you've got tissue type changes and graduate. And if nothing else, you don't want to interfere with that funnel or that tunnel or that information coming up and out, right? I mean, if you've got primitive reflexes, if your cranial nerves aren't operating 100%, you know you have brainstem challenges, and we want to train it out. We want to find them and train it out.